My name is Andrew Nash. I'm doing my interview on the Mike DeRosa.
Mike DeRosa, chair of the Physician Assistant Department at San Bernardino University in Oakland, California.
What are one of the things that made you want to become a PA?
When you come out of college in the late 80s, early 90s like I did, you had a few choices. Grad school was one, med school was another. I didn't really know about the PA profession at that time. And to be honest with you, I didn't really want to go to school with the guys who were going to med school anymore. Had I known about PA, I would have done it back then. But glad I did.
You used to tell me one of the most important things, or one of the most useful tools it was for you, is to always use patient history. Always rely on patient history, and that's one thing that stuck with me when I would go and shadow with you guys. Do you still feel like that's something that's very important?
Absolutely. As a practitioner, I am someone who does not order a lot of tests. I do my physical exam for sure, but I still get most of the information I use in making a diagnosis from taking a history.
We also used to say, in the ER room or in the ER, you may actually help one patient. You're seeing a bunch of patients, but you're only helping one. Could you explain the difference between private care versus working in the ER and stuff like that?
Everybody's got their opinion, and people who like working in the emergency room setting or emergency department setting often say it's fast-paced, it's exciting, and it can be for sure. It's certainly, it's got a level of adrenaline attached to it that working in primary care doesn't have.
So, for young and upcoming PAs, what would be your advice for them?
Don't rush it. We look at two categories right now that make up about 80% of your application. We look at your GPA, of course, and we look at previous clinical experience. And we try to look at things like life experience and service activities and that too. But about 80% of our initial review of your application comes from your GPA and your previous clinical experience.
Okay.
So take the time you need to take to get good grades. And then take the time you need to take to get some hours of experience. So the biggest piece of advice I have is don't rush it. We see a lot of applications from people that are 23, 24, even 21 or 22, and they're right out of school. And they might have a few hours and they might have good GPAs, but very few of those people end up getting in the program at that point in time. Because they don't have enough to really be competitive. They don't have enough under their belt to be a strong candidate.
I guess my next question would be, what would be the most challenging part of the job?
The number of ways you're trying to manage the distractions, the number of ways in which you're kind of pulled away from the things that you really like about the job, and that's probably true of anybody's job. PA, by its nature, I always like to say there's something for everybody in PA, and I mean that in a negative way. Meaning, like, there's something to trip every student up in a PA education. So people who come in with a background in kinesiology or physiology probably do pretty well in the physiology course and that sort of mechanistic, kind of environment.
The $1 million question, what's the most rewarding part of your job?
Just having somebody say thank you. It's like one of the most rewarding parts of the job. Having that fireman who's retired but served the community for 30 years as a fireman, and for several years, I just had this patient for several years. He can't feel his foot. His foot's numb, and everybody thought he was pushing diabetes and becoming diabetic. We could never get a high blood sugar on him, and then finally realized it's not diabetes. It's probably a nerve compression thing from the trauma of his job. This guy served the community for 30 years, and now his body's paying the price for it. And so if I can help him, right, to live out the rest of his life in comfort and be able to do the things that he wants to do after he gave himself for the community, There's like nothing there.